A warm welcome to you all, my dear students. Today, let us learn about healthcare as a right. You are going to become Indian medical graduates, and Indian medical graduates, as per the goal of the National Medical Commission, should be a graduate with the following requisites. They should have adequate knowledge, skill, attitude, values, and the responsibilities. Why it is important? By these requisites, he can appropriately and effectively exhibit his skill as a doctor of first contact of the community at par with the medical graduates in any part of the globe. The aim is he should be a good clinician. He should act as a leader to carry out the healthcare activities as per the needs of the community decided by the healthcare system. He should be a good communicator, and he should have an urge to learn new things, because science is not static. The new advances will come, new treatment modalities, and new investigation tools will come, and he should be well updated with the ongoing advances in the field, and he should exhibit the professionalism. He should be a good clinician in various aspects of a preventive, promotive, curative, and palliative care, so as to exhibit a holistic care to the needy patients and needy community. One of the important skills that's required is he should be a good communicator. Why? He has to collect the essential information and he should analyze the problem, prioritizing the need, and depend upon the patient condition. He has to convince the required the treatment by means of effective communication, informing the need of a particular treatment. Why it is essential? What are the alternatives that are available? What complications are, what are the sort of side effects or adverse effects may happen with the treatment, and how the problems will be tackled if at all some of the adverse effects occur when the treatment is essential. And this is informing the patient relatives, and the other people who can take the decision with regard to the treatment. Suppose the patient has to undergo surgery. The patient needs to know everything about what sort of surgery he has to undergo, why he has to undergo the surgery, what will be the problems during the perioperative period, which involves pre-operative, per-operative, and post-operative period. What will be the cost of the treatment? And if at all the complications occur, who will handle the complications? And what about the compensation? What will be the cost? Everything has to be conveyed. And if at all the patient is having any doubts to be clear, it has to be discussed and it should be discussed in such a way, or the information should be given in such a way that he can understand. It should be in the language which is understandable to him. And further, the acceptance has to be taken in the form of consent, understanding the consequences of this and the need of the surgery. The patient who is in the age group that he can give the consent, that has to be documented and signed by the patient if he is adult. Adult means after attaining 18 years of age. And it should also be signed by one more witness, so that the legal document is well protected for the doctor's safety. And then the physician should sign it, putting the date. The consent should be taken separately for anesthesia and surgery. It should not be taken into consideration that if the consent has been taken for the operation, it's enough. It should be for the anesthesia and surgery separately. It should be taken, and not only for anesthesia surgery, whenever any invasive procedure is being carried out, the treatment associated with some intervention, the consent has to be taken. What about the pediatric patients? Age below 18 years includes the pediatric patient and the adolescent. For the adolescent, whatever the treatment modality has to be explained to him, because they are having a right to submit their body for the treatment. We cannot force anybody, and they can understand what are the consequences of treatment. For that reason, they have to be conveyed, and their signature has to be taken along with the legal guardian or caretaker. For the age below 12 years, the parents or the legal guardian should sign the consent, and it should be with the willingness. It should not be with the coercion. It should not be with the force, with the threat. If at all After explaining the consequences of the treatment related factors, if the patient is not ready to give the consent, it is a refusal. This comes under informed refusal. The document should be maintained in the form of informed refusal. He can sign, otherwise you can have the informed refusal. It should be signed and put the date, and the physician can maintain the record as an informed refusal. So he should have effective communication skill for the patient, family, colleagues, and the community. He is a lifelong learner. He has to learn the new techniques, as I told previously. He has to adopt the new skills, new therapeutic approaches, because the medical science is advancing and he should know the advances. So he has to treat the community as per the need of the hour. He should act like a professional. He should maintain the confidentiality. The patient's some of the personal things, some of the disease related things should not be unnecessarily exposed. And he should maintain a professional relationship with the colleagues. Colleagues should be respected. And the patient's dignity should be maintained. And one should not carry out the things which will hurt the feeling of the patient. Next, healthcare as a right of the individual. So, the healthcare system should be approachable to each and every citizen. It is his right. It should be accessible without any discrimination of a caste, creed, religion, socio-economic status, is a regionality, and he should get the washable, acceptable treatment of the standard. So doctor is a key player in the healthcare system. He has to follow the rule of justice. Rule of justice is a guiding principle in patient care. And enjoyment of the highest and attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social condition. World Health Organization has mentioned this in the Constitution of the World Health Organization. The right to health for all people means that everyone should have access to the health services they need when and where they need them without suffering a financial hardship. No one should get sick or die just because they are poor or because they cannot access they should not be denied of accessibility to the healthcare services. Right to health is part and parcel of right to life, and therefore right to health is a fundamental right guaranteed to every citizen of India under the Article 21 of the Constitution of India. Article 25 of the United Nations Universal Declaration of Human Rights lists medical care as a basic human right. So, National Medical Council has a goal that Indian medical graduate understand the importance of right to health so that following his graduation, he will be available to provide the services to the region, state, or the globe as per the standard that any medical graduate can provide internationally. To impart this knowledge, so many activities to be conducted so that you can understand your involvement in attaining the required knowledge with regard to health as a right. So you must able to understand and analyze regarding the doubts which will help to clear the probable doubts with regard to the attainment of this important topic is health as a right. You must be able to understand, you must be able to answer the questions: is health care a right or a privilege? What are the implications of health care as a right? What are the social and economical implications of healthcare as a right? What are the implications for the doctors? So I wish let us have a debate on this subject, dividing you into two groups, pro and cons. Health is a right, one group. Health is a privilege as other. So this is in a nutshell with regard to health as a right. If you are having any doubts, please come up with your questions, which will be answered to clear your doubts.